but the issues, not the person, but the issues that hurt older people.
Do you feel the legislature, as it is set up now, is hostile towards seniors?
You're talking about the state legislature?
Yeah.
No, I don't consider them hostile, and in fact, we are working, the truth is, Republicans are in the majority in both bodies. The governor is a Republican. And so when we are trying to get, the programs we talked about, funding for Older Americans Act, nutrition, transportation, family care, expansion, etc., we realize we have to get Republicans to do that. Now, we would like Senator Schilling, as a member of the Joint Committee on Finance, to be supportive, but we know that if she does a motion and it's only her, it's likely to fail. But if we can get a Republican on the committee to make a motion and it gets supported on a bipartisan, and that's the only way you can get it done. So we know that. So we're smart enough to know that unless we get a Republican sponsor of these amendments, they won't happen. So we're working.
Senior Care is one of the best programs in the country. 99,000 seniors and people with disabilities. That wasn't a Democrat. That was a Republican governor, McCallum, Thompson. Then Democrats took a lead in that. So it's we don't see enough of those things. That's the key. I mean, you raise a point that clearly it's just kind of mind-boggling. They were able to work together and solve the problem. Governor Walker wanted to change the law as policy as far as senior care. He wanted that to be a secondary role in paying for your medications and Medicare Part D. Both Democrats and Republicans got together and said, no, we're not going to change a program that is working well for 95 to 99,000 people with disabilities and seniors.
So you're saying there is some point where the Republicans and the Democrats are actually working together?
I said I wish we could do that again.
Oh, wish, okay.
Well, I mean, it's on the Joint Finance Committee, again, I think some of the things we're proposing will happen. And it will happen because it's a bipartisan vote. It won't happen any other way. There's the Gang of Eight that's in Washington, for Republicans, for Democrats. So people like Billy and myself would like to see us go back to when we used to do that. Any other questions? Yes, sir.
I have a Social Security question. Our government has borrowed the money out of Social Security. Is there any way to get them to put that back in there?
Good question. I didn't really address that. No. But, just again, a reminder, that money is guaranteed. Why? Because while Democrats and Republicans have taken that money from the trust fund, they've issued treasury bonds. Now, some politicians want to scare people like yourself by saying those are just a bunch of papers. They're meaningless. Well, as my friend Tom always says, why don't they tell that to China? Why don't they tell that to Japan? There's only one way that anybody in our state, a senator or a congressperson, can make those things just pieces of paper, and that is take a vote and put a default on those treasury bonds. And I'd like to see the day that any elected official does that to your earned monies. It'll never happen in my lifetime. Some of the things I said today about taking the cap off, that might not happen in my lifetime. It seems like a fair way of doing business versus a changed CPI, from my perspective. But it's just a falsehood. Unless a person wants to tell you that they're going to default on your treasury bonds and they're going to vote that way, and I can guarantee you that person will be kicked out of office the day they try that. The day they try that.
Should we be stressing overall savings? Like transit reduces traffic, so you save money overall. Like preventative health care, like schools are cheaper than jails. Shouldn't this be our primary focus?
I agree with that. I certainly agree with that. We say about that is they're cost effective. They're more cost effective than, for example, when I talk about family care, you know, serving older people in their own homes is more cost effective than paying for them in a nursing home. And guess what? People want to stay in their own homes. So yeah, that's an argument on most of the things we talk about: transportation, family care, Social Security, Medicaid. Let me just, we have two staff people here from Senator Baldwin's office and Congressman Kine's office, and we want to give them a chance to speak to you. But I just want to wrap up here by saying to you that you got a packet, and the one that starts with the President of the United States, and it goes over on the back, and it tells you how to get in touch with all of these, all of your elected officials, from the President to your U.S. senators, to your congressperson, to the governor, to your state senator, Jennifer Schilling, and then your two state assembly representatives. It gives you addresses, phone numbers, email addresses, and so forth, so that you can communicate with them. And you know, we've sort of put a lot on your plate today. We've talked about two big federal issues, primarily Social Security and Medicaid. We've talked about at least three state issues, funding for elderly programs such as nutrition, transportation issues, and family care. Those are state issues. And I think what we would ask you to do is, if you have concerns about any of these programs, for yourself, for your neighbors, for your relatives, you know, maybe you have